Mental Health Awareness Month began this week, highlighting the hidden struggles many people face in hopes of breaking the stigma so fewer people suffer in silence. Tonight, our Emily Longnecker shares the story of an Indiana woman still trying to move forward years after losing her husband to depression.
Grief it's not linear.
Something Julie Karash has learned in the past 3 years after her husband Greg overdosed on heroin and fentanyl.
There are days that I think I'm doing fine, and then something will trigger an emotion or a memory, and I get hit hard.
Top left is actually a picture of me scattering Greg's ashes.
Despite the roller coaster of emotions, Julie is sharing her husband's story with others about depression, chronic pain, and addiction. Greg battled all three.
Somebody can look perfectly fine on the outside and be struggling and really having a hard time on the inside and not feel like they're supported because they don't have, a cast on their leg. They don't have a bandage on their head. And it can feel like they should just suck it up. And that can be very isolating.
Mental health injuries, often you can't see them, so people don't think they're real.
But they're very real, says licensed mental health counselor Kimball Richardson with Community Health Network.
Mental health issues don't discriminate.
Richardson says he thinks the stigma surrounding mental health is lessening. The challenge now.
We have a strain on the system right now, and there are so many people really deserving mental health care, and it is taking some time to get in to see some folks.
That's why Richardson says it's important to have support.
It's sort of analogous to a brake light. Other people see it first before you do.
Julie Karash is certainly thankful for her support system after losing Greg, one that keeps her going, especially on the tough days.
I miss him every day, but I'm really thankful for the community I have around me. I have a community that is not afraid to have people not be okay, which none of us are okay. It's just a reality of life.
Accessing care to treat mental illness is a problem for lots of Hoosiers. In fact, more than 4.4 million people across our state live in communities that don't have enough mental health professionals. Insurance is another big issue. Hoosiers are 2 times more likely to be forced out of network for mental health care.
There are quite a few mental health professionals who don't take any insurance, and that is primarily because insurance companies don't reimburse well for mental health.
There are changes in the works, though. Later this year, our state's launching a new crisis line that will allow Hoosiers to speak with trained counselors over the phone. That number is 988. We also have the number posted for you tonight. It's on WTHR.com. And that wraps up tonight's big story.